Good afternoon, ladies and gentlemen. My name is Anita Nielsen, and I'm the Senior Director for Annual and Planned Giving at Toronto General and Western Hospital Foundation, and I am delighted to welcome you all to the second part of our program today, our 2012 Fall Behind the Scenes Lecture. I'm so pleased to see everyone today. We have a very large group joining us, and we're now in our 6th consecutive year of delivering this lecture series, where we've covered a wide spectrum of topics based on what you, our donors, have told us that you would like to hear more about. And of course, the many exciting breakthroughs and discoveries taking place at our hospitals would not be possible without your continued support. So once again, on behalf of all of us at University Health Network, thank you very, very much. As Tennis mentioned during our special announcement, the other hat that I wear is as campaign director for the Vision program. And so it gives me added pleasure today to welcome today's guest speaker, Dr. Allan Slomovic, who is one of our leading ophthalmologists at the Donald K. Johnson Eye Center at Toronto Western Hospital and holder of the Owen and Marta Boris Chair in Vision Stem Cell Research. I've had the pleasure of working with Dr. Slomovic and his colleagues for the past year, and not a day goes by when I am not inspired and humbled by their extraordinary ability to transform lives. We have several members of our ophthalmology team with us here today, including Dr. Sean Singer, Dr. Michael Brent, Dr. Martin Steinbach, and Dr. Jeremy Sivak. I apologize if there's anyone else that's arrived that I haven't been able to take notice of. And I am delighted to also welcome many of Dr. Slomovic's patients here today, some of whom you're going to meet later on. For those of you who've had an opportunity to read the latest issue of Report on Your Support, you'll be familiar with one patient in particular, and that is Taylor Binns. Dr. Slomovic and Taylor crossed paths after Taylor sought treatment from a number of specialists for what eventually turned out to be a limbal stem cell deficiency. And Dr. Slomovic is one of the few surgeons in North America that is equipped to treat a condition such as Taylor's. I would now like to call upon Kathy Sabo, Senior Vice President and Executive Site Lead, Toronto Western Hospital, to bring greetings.
Thank you. Thank you, Anita, and good afternoon, ladies and gentlemen. It's my pleasure to welcome you here on behalf of Toronto Western Hospital and the staff and physicians at the Krembil Neuroscience Centre. We're always excited to see and have our donors hear about the work we're doing. Today is no exception. These behind-the-scenes lectures have been great events, well attended, and there's a lot for us to share with you around our breakthrough innovations and the exemplary research that's happening in different program areas across the hospital. And today you'll hear about one of our outstanding programs, ophthalmology. This field and the evolution of treatment modalities has grown significantly, curing blinding eye diseases and returning sight in cases that were deemed impossible just a few years ago. At Toronto Western, we are very proud to be Canada's largest vision program, treating some of the most complex cases of eye disease. And it's a very exciting time for us because we're coming closer to the completion of our Krembil Discovery Tower. Many of our research labs that are currently in one of our older parts of the facility are going to move to new state-of-the-art design space that will give a wonderful environment for our scientists to continue to do the pioneering work that they're doing in many of our medical specialties. And the area of transformational research and discovery holds great promise against many diseases of aging that we face today. Many of you have contributed to this important initiative through donations to the BRAIN campaign. And so on behalf of our scientists, our physicians, and the hospital staff, I want to thank you very much for your support. And I'm now going to call on one of my colleagues, Dr. Christopher Page, who's going to bring remarks and introduce today's speaker, Allan, a wonderful colleague. Dr. Page is Vice President of Research for University Health Network. It's a position that he's held since 1998. And to give you context of the scope of UHN as a research hospital, he oversees a research enterprise that consists of over 500 researchers, 850 trainees that include fellows and graduate students. Included in this portfolio is the Toronto General, the Toronto Western Research Institutes, the Ontario Cancer Institute, affiliated with Princess Margaret Cancer Centre, and of course the newest member of UHN Network, which is the Toronto Rehabilitation Network. In 2011, the Ontario Cancer Institute, Toronto General, Western collectively published over 2,100 papers and are in the top ranking in Canada for medical research. So, Chris, come on up and bring more remarks on behalf of the Research Institute. Thank you.
Thank you, Kathy. I'm getting a little tired just listening to that job description. Good afternoon, everyone. Thank you for being here. As Kathy mentioned, this is an area of promising research here at UHN, which rolls up into the McEwen Center for Regenerative Medicine, which focuses on research starting with stem cells and other regenerative techniques. Under the direction of Gordon Keller, McEwen Center is a world leader in this kind of research. It's amazing what these guys can do. They take stem cells and they can put out the other end heart cells, lung cells, cells that can make insulin, cells that can make cartilage. And this is really, in many ways, the future for medical treatments. But treatments is the key. Those basic scientists that are putting all of that effort into making all of those cells have to now hook up with the doctors who are able to use that technology. And that's where a doctor like the one we're going to hear from today, Dr. Allan Slomovic, comes in. Dr. Slomovic is the research director of the Cornea External Disease Service in the Donald K. Johnson Eye Center at the Toronto Western Hospital. And thank you, Donald, for your continued support. He's an associate professor, associate professor of ophthalmology at the University of Toronto, and as Kathy said, or as Anita said, holds the Owen and Marta Boris Chair in Vision Stem Cell Research. Prior to starting medical school, Dr. Slomovic completed a master's degree in clinical psychology at the University of Montreal. He then went to medical school at St. John's in Newfoundland, and then an internship at the Montreal General Hospital. Not done with his education, he went to New York University for internship, followed by 2 fellowships at the Palmer Eye Institute in Miami, Florida. It's a good thing you finally settled down somewhere, Allan. From there, he came to Toronto. On the teaching side, Allan has trained 32 fellows in cornea external ocular disease of the eye from all corners of the world, including Canada, US, Israel, Australia, Singapore, Malaysia, Thailand, Philippines, and Great Britain, a testament to our own philosophy of having global impact. Several of his fellows are here. Can you wave the fellows? There they are. And it's important that you know about them because that is the future, and that's one of the things that Allan has spent a lot of time on, and he's been recognized for it. Recently, he was the first provincial winner of the Mentor of the Year Award by the Royal College of Physicians of Canada, which is a very prestigious award to win. And again, it's a testament that this is a fellow that not only takes the latest in research and helps his patients with it, but he also is concerned about the future of clinical medicine and spends a lot of time training his fellows. We're really pleased today, and I want you to join me in welcoming today's behind-the-scenes speaker, Dr. Allan Slomovic. Allan.
Thank you, everyone. It's really an honor and a privilege for me to be here today to speak to you about some really exciting new changes that are occurring at the Donald K. Johnson Eye Center University Health Network, and that is our ocular stem cell transplantation program. I'd like to say that I'm very honored that to see my friends, my colleagues, my patients, and especially my family, my wife Rona and my daughter Jackie, who allow me to do what I need to do in order to try to make some sort of a global impact in this area of stem cell research. I would be remiss if I didn't acknowledge the tremendous work done by UHN Foundation, many of whom you've heard speak today. Tennis Hansen, Anita Nielsen, Brady Hambleton, Robert Windrum, and Rebecca Valenti. So just join me in giving them a round of applause of our appreciation. There's 5 things I want to do over the next 40 minutes. I want to talk to you about what ocular stem cell disease is. I'll tell you a little bit about what some of the causes of stem cell disease are. I'll tell you a little bit about the treatment, and basically that consists of 2 parts, stem cell transplantation and artificial corneal transplantation. I'll also describe for you the history of the ocular stem cell transplantation program at the University Health Network, and especially a little bit about the remarkable people that made this program happen. I'll then conclude with a couple of case histories which I think can show you the transformative effect that this new technology has on the lives of our patients and their loved ones. And I'll conclude with some comments about what I think are the future goals for our program here at University Health Network. So what is ocular stem cell disease? This is a chronic, blinding, painful condition where there is damage to the naturally occurring stem cells in the eye. Fortunately, it's relatively rare, but it can have devastating consequences. Typically, it involves both eyes, although rarely it may involve just one eye. In order to understand what stem cell disease is, it's important to understand what happens to the eye in good health. And these are some photographs of absolutely normal eyes. And I'd like to just talk to you a little bit about the anatomy of the normal eye. And you can see in this little cartoon over here, this white part of the eye is the conjunctiva. The cornea is this part of the eye. It forms the watch glass, or the front surface of the eye. And right around between the conjunctiva and the cornea, for 360 degrees, that's where the stem cells are located. Now, the cornea is a fascinating tissue. I've spent my life studying it, and I think I've just scratched the surface. It is the only clear tissue in the body. It's perfectly transparent, and this clarity of this tissue is what allows us to have clear vision and excellent vision of the world around us. It is also the only tissue in the body that does not have any blood vessels. Note over here you can see in the conjunctiva there are blood vessels, but you can see in the cornea there are absolutely no blood vessels. Every tissue in the body except the cornea has blood vessels. This is what nourishes the vessels. The cornea, over millions of years of evolution, has found a way to get its nutrition from the fluids in the front of the eye and thereby not have any blood vessels. If there would be blood vessels, this would significantly impede our ability to see clearly. This is what happens when there's stem cell disease. Notice the blood vessels which are coursing through the cornea. These are 2 different patients. And notice the lack of clarity of the cornea. So basically, this results in a very significant reduction in vision. These patients are blind. So I've mentioned that stem cells are surface cells that are found at the periphery of the normal cornea. They function to do 2 things, and they do this very well. First, they keep the cornea clear. And second, they function as a barrier. They prevent the migration of the vascularized and cloudy conjunctival cells from migrating over to the cornea and causing stem cell disease. With stem cell disease, what happens is the patient experiences blindness and pain, and in the vast majority of patients, this is a bilateral condition. In other words, it affects both eyes. What are some of the causes of stem cell disease? Well, the first cause, I've sort of put this in the order. When I first made this list a couple of years ago, I thought we'd never fill it. We've actually operated on each one of these causes of stem cell disease. The first is it can occur secondary to contact lens wear as a very rare complication of contact lens wear. It can occur in graft versus host disease following bone marrow transplantation, and we know that there's more and more bone marrow transplants being performed today. It can occur after multiple operations. The most common ones are corneal transplantation. It can occur after chemical burns, and this is very significant. Most of these patients are young, gainfully employed, and all of a sudden there's this catastrophic episode where they get splashed in the eye with either acid or a lye, and they lose their vision. They can no longer work. They have to go on disability. So being able to offer these patients solutions is tremendously important. And a fifth condition is congenital conditions such as aniridia. Now, the traditional treatment for a scarred cornea has always been a corneal transplant. As you can see, going from a scar like this to a perfectly clear cornea transplant over here. However, this is not going to happen in a patient with stem cell disease. This will not be successful because the underlying problem is a disease of the stem cells that function as a barrier to prevent the abnormal conjunctival cells from invading the cornea. Without first treating the underlying stem cell disease, these abnormal conjunctival cells will invade the new transplant as it did the patient's own cornea, and these transplants are doomed to failure. So there are two options currently available for treating stem cell disease, and I'm very pleased to let you know that both of these therapies are currently being performed at the Donald K. Johnson Eye Center at University Health Network. The first is a stem cell transplant, and the second one is an artificial cornea transplant using what we call a Boston keratoprosthesis, or for short, a Boston K-Pro. And I'd like to just briefly describe both of these procedures to you. I'll start with stem cell transplantation. This is a two-part operation. There are two separate operations being performed. In the first operation, we have to harvest stem cells from a healthy donor eye. There are three options available to us for where we can get these cells. If it's strictly a monocular disease, which is unusual, it's usually bilateral, we can take it from the patient's other eye. If not, we get a donation of stem cells from a healthy family member. And a third option, if that's not a possibility, is to get it from a cadaveric donor eye, which is provided to us by the eye bank. So the first step is you harvest these limbal stem cells. Patient then gets wheeled out of the room, and the donor, the recipient rather, who has the stem cell disease then gets brought into the operating room. Now the next step is we would remove all of the scar tissue and vascularized tissue from the surface of the patient with the stem cell disease, and then we would transplant healthy stem cells that we've just harvested. Our program at the University Health Network is really quite unique, and it's really one of a kind in Canada. I hope I'm not being boastful by saying that. We have a comprehensive approach where both the stem cell donor and the stem cell recipient are very carefully evaluated by a team of cornea specialists, renal transplant physicians, nurses, pharmacists, and social workers. The family members are screened by the renal transplant service to see who is the closest match as a donor. Once the appropriate family member is identified as a stem cell donor, both the patient and family member are brought into the operating room, and as just described, with two separate operations, healthy stem cells are first taken from the donor and transplanted to the recipient. Following this, the patient is maintained on immunosuppression therapy to prevent rejection of the stem cell graft, and they're very carefully monitored by our renal transplant service while they're on the systemic immunosuppression. The second procedure is an artificial corneal transplant known as a Boston keratoprosthesis. So this is used, here's an example. We'll see a little video which he'll tell you in his own words about his experiences. This was a patient who developed stem cell disease from having undergone 4 previous corneal transplants by another surgeon. He was an older patient with some significant medical issues like diabetes and liver disease, and therefore he was not a good candidate for the systemic immunosuppression, which is required with a stem cell transplant. Basically, we knew that a 5th transplant would certainly result in failure, and we therefore performed an artificial corneal transplant on this patient, and he regained useful vision in his eye. This is what it looks like when it's been transplanted in. You'll see a little bit later on, this is a close-up picture. You don't see this. Cosmetically, it's certainly a lot more acceptable when one is just looking at the patient. That's a magnified view. Now, the Boston K-Pro is made from a very high-grade acrylic. It's not transplanted human corneal tissue, and therefore, there's no concern about invasion of diseased stem cells onto the artificial cornea. There really is no risk of rejection and no need, therefore, for systemic immunosuppression. We typically perform this in our older patients or patients who have significant other medical problems like diabetes, liver disease, renal disease, which makes them not a good candidate for systemic immunosuppression. However, infection and glaucoma are 2 big concerns in this group of patients, and they therefore need to be maintained indefinitely on topical antibiotic and steroid drops. To date, our program has performed 5 stem cell transplants. We have another 5 on our waiting list, and 20 artificial corneal transplants. Again, this is the first comprehensive ocular stem cell transplantation program of its kind in Canada. And I'd like to tell you a little bit about the history of this program and about some of the remarkable people that made this happen for our patients. I'd then like to conclude with a few interesting case histories and a glimpse of my future plans for the ocular stem cell transplantation program at University Health Network, which I think has the potential to be the leader in all of North America. So, our program got started on April 30th, 2008, when I received a call from a Ms. Bronwyn McCurdy, clinical epidemiologist at the Medical Advisory Secretariat for the Ministry of Health, requesting detailed information about ocular stem cell transplantation. Just as a point of information, since 1999, the province of Ontario had approved and paid for 8 patients to have the procedure performed outside of the country. We're going to meet one of these patients, a very special individual, a little bit later on today. Now, these cost estimates are not my cost estimates. These were done by the Ministry of Health. The estimated average cost for the procedure in the United States was $57,583. The estimated cost to have the same procedure performed in Ontario is $2,291 all in, including hospital and physician fee. Now, I'm not a health economist. I'm a physician. Just imagine this in your own mind. You have a patient who's blind, who's in pain, and now you're telling him to go have a surgery by someone who he may not have met or may have met once in his life without their support network. How much better is it to have all of this done locally? You know, that's where I'm coming from, and I think that's something that we all have to work for. Anyways, several hours of consultation and several months later, on July 2008, the Ontario Health Technology Assessment Service, which is a branch of the Medical Advisory Secretariat for the Ministry of Health, produced a 60-page document on limbal stem cell transplantation, an evidence-based analysis. This report found, and I quote, "Limbal stem cell transplantation is an effective treatment for limbal stem cell deficiency," and they suggested that Ontario establish this at specialized center that has expertise in both ophthalmology and transplantation. Their final conclusion was a strong recommendation to start this program in Ontario, and the University Health Network was selected as the appropriate site to have this very subspecialized program. In 2008, I placed a call to Dr. Catherine Zahn, who at that time was the Executive Vice President of University Health Network, expressing my interest in starting this program. I received strong support from Dr. Zahn, who arranged for me to present this at the Medical Advisory Committee at University Health Network, where once again we received strong support. So my next step was to contact Dr. Ed Cole, Physician-in-Chief and Head of the Nephrology and Renal Transplant Program at University Health Network, and co-founder of the Stem Cell Transplantation Program. Dr. Cole and the renal transplant team brought with them years of experience in the ethical and moral issues dealing with living donor patients, and a tremendous background in immunosuppression, which is vital in making our stem cell transplantation program successful. The combined resources of the cornea surgeons and the renal transplant team at University Health Network is really what makes our program so unique in all of Canada. Following this, the next step was to contact Dr. Gary Levy, Director of the Multi-Organ Transplant Program and Director of the University of Toronto Transplantation Institute. UHN is the home of Canada's largest transplantation program and is also one of the world leaders in organ transplantation research. Dr. Levy and his team played a key role in, through the examination and evaluation of potential living donors, as well as ensuring that all regulatory compliance activities and documentation are properly implemented. Dr. Levy's living donor program and mandate to develop bench-to-bedside transformative new therapies offered us tremendous opportunities for research advances that really have resulted in improved patient treatment and outcomes. With the help of Mary Ann McNeary, who at that time was the Senior Clinical Director for Crimbal Neurosciences, we put together the Ocular Stem Cell Dream Team. However, we still needed to develop a proposal to the Ministry of Health to get them to accept and fund this program. Our submission went to the Health System Accountability and Performance Division of the Ministry of Health on April 16, 2009, and with the invaluable help of Marnie Weber, Executive Director of Strategic Planning, we were successful in our submission and receiving government funding for the first comprehensive keratoid limb cell transplantation program in Canada. So just in case you think that our stem cell program is 2 or 3 doctors working in some office somewhere, it's not. This is the group. This picture was taken at our last meeting. We meet on a regular basis, and it's comprised of residents, fellows, both research and clinical. We have cornea subspecialists, we have renal transplant specialists, we have nurses, pharmacists, social workers, all working together with the common vision uniting us, and that is to make our stem cell patients see again. So in July 2010, the next step, I went, myself along with 2 OR nurses, flew from Toronto Western Hospital to the Cincinnati Eye Institute to observe Ed Holland, a colleague and friend and a world leader in ocular stem cell transplantation, perform several stem cell operations, and we also had the opportunity to meet with his team and also to examine and speak with some of his patients. On November 30th, 2010, I performed the first ocular stem cell transplant at University Health Network, and we'll hear the story about this personally from our patient in a little while. But I'd like to just play this video for you, which talks to this.
My name's Taylor Binns. I'm 23 years old and I suffer from limbal stem cell deficiency. I grew up in Aurelia, Ontario with my mother and father there, and as well with my 6 siblings. Jordan, Tori, Addie, Aiden, Yana, Christy. I think I got them. When I came to Queens, I was quite happy. My first year went very well. And then the summer came and then I decided I'd go to Haiti to help there. The clinic there that takes care of just thousands and thousands of people that need help. So the big thing there was they needed a new roof. We went to the beach for a day and then I come back that night and just had the most severe pain and redness in my eyes that I've ever had in my life. So in maybe a year's time, I went from almost 20/20 with my glasses to now being legally blind. The pain. The pain is the worst. I can deal with losing the vision, but you can't get rid of the pain. On the scale of you're being constantly stabbed in the eye and it just never stops. Taken away from me mostly was the freedom, the things that almost before were me. Playing all these sports, being on a team, being able to drive wherever I wanted. All these things were now taken away. With my schooling, I can't see a lecture screen. So I rely on other people, the notes. I look off my computer and just hope for the best that I've hit the right key and I can blow the fonts up to about a 30 and then see it. And I just try to act normal as much as I can and just accept that this has happened and I have to deal with it.
Well, right away I knew like if I was a match that I'd definitely do it. Just to know like if it's gonna help him, then I kind of do like whatever it would be to help him out. He's been through a lot, so it's kind of the least I could do.
She's giving me everything back that I've lost over the last couple of years. So, yeah.
He was really happy and he's like, we'll go shopping, I'll buy you that coat that you wanted or whatever. I'm just like, you don't really need to do that. Like.
So within the next year or two, I should have most of my vision back. It'd be pretty sweet. It'd be nice. I want to hope for the better. I hope I can get back to doing the things I actually like. Love to be able to play rugby again, to be able to drive. Just things that people take for granted, I'm really looking forward to. I can drive now, which is amazing. I'm basically 20/20 with my glasses on. That's better than I had before surgery. I'm almost in disbelief. Since surgery, I've had no pain whatsoever. I haven't been able to say that for 4 years. I just have the freedom to do anything, all these things which I couldn't do before. I'm playing rugby right now for the Aurelia team. It's kind of validation that everything's normal for me as of now. And this is pretty much the thing that really defines that for me, being able to be at the pitch on Saturdays. I love being out here playing rugby. My dreams, as of right now, I'm currently studying for the MCATs, considering going into medical school to be an eye surgeon. I just obviously want to thank my sister for number one. Without her, who knows where I'd be. Her and everyone at UHN, Dr. Cole, everyone with Dr. Slomovic's team. Dr. Slomovic's the man. I can't thank any of them enough for what they're doing, and I can just hope that through things like this and through donors that more people can have this done for them and get their life back.
We're not done. Very honored and pleased that Taylor Binns is here today, and he's going to speak to you in a little while. I'm just going to take a little bit more time, if you don't mind. The story doesn't end there. The operation was November 30th. Made the TV, made the newspapers. On December 25th, 2010, Christmas Day, I received a call from the late Mr. Owen Boris, letting me know that he read about Taylor's story in the newspaper, and his words directly to me were, "When you get home, I'd like you to call me. I want to try to help you with this." After some discussion, the Boris family decided to make a very, very generous donation and to create an endowed chair to support cornea and stem cell transplantation and research. And this really has propelled my program forward. And the baton has been passed to the next generation. Mr. and Mrs. Boris's children, Jackie Work and Les Boris, are now funding my travel to centers of excellence around the world in stem cell transplantation. I'll tell you a little bit more about that in a little while. One thing, once we got our stem cell program going, it became evident that not all patients with stem cell disease were good candidates for stem cell transplantation. In 2011, based on this new information and with the invaluable help once again from Marnie Weber, we approached the Ministry of Health and we got them to agree that UHN could expand their stem cell program to include artificial corneal transplantation, the Boston K-Pro that I've been telling you about, for patients who had limbal stem cell deficiency who were not good candidates due to conditions, underlying medical conditions. For this select group of patients with limbal stem cell deficiency disease, we are now able to offer them an artificial corneal implant as a very viable alternative to the $5,000 prosthetic, and this is going to be covered by the Ministry of Health. I'm going to conclude with 3 case histories which will give you some idea of the really tremendous impact that this surgery is having on the lives of patients. And some of my Boston keratoprosthesis patients are here today, and I'm very honored by their presence. Remember, this surgery is not perfect. This is cutting edge. We have had our setbacks. We've managed to deal with them, fortunately, to date, but this is not the final solution. We are working on this, and I think with research, this will only get better. But remember, right now, there really is no other treatment for these patients. This is a patient who had 4 previous corneal transplants performed at another institute. He had multiple graft rejections and failures. His last transplant was performed 3 years prior to his consultation in my office. He's currently blind in both eyes and experiencing severe pain in both eyes, and he's not able to get around on his own. I'm going to show you a video 6 weeks after his Boston K-Pro operation in one eye. Now, this is not going to be as good as the video produced by University Health Network. I made these videos, so please bear with me. So you were referred to us with a history of having had 4 corneal transplants performed in each eye. Each one of the transplants failed and resulted in an edematous cornea with blurred vision. And then we offered you the possibility of a Boston keratoprosthesis for your left eye. Can you comment on your experience?
A totally painless experience that has offered me the freedom of catching a bus, of of getting around without hanging onto a person's arm. It's offered me total freedom. It's total comfort. This is the best thing that's ever happened to me.
Thank you very much. Our next patient is here with us today. Can you stand, Mrs. Hogg? Thank you for coming. Thank you for coming and allowing us to share your history with the Boston keratoprosthesis. Mrs. Hogg underwent a bone marrow transplantation in 1986 and presented to us with graft versus host disease involving the skin, liver, eyes, and mouth with marked stem cell disease of both eyes. She underwent 4 failed corneal transplants in the right eye and 2 failed transplants in the left eye. Before her Boston keratoprosthesis, she was blind in both eyes. And this is our interview with... You have graft versus host disease, and you had 4 corneal transplants for corneal scarring in your right eye and 2 cornea transplants in your left eye. Unfortunately, because of the underlying problem that is graft versus host disease, these transplants rapidly failed and they left you with legal blindness. You were only able to see hand motions in front of your face, not useful vision. You were not able to get out on your own. About a month and a half ago, as part of our stem cell program, we performed an artificial corneal transplant called a Boston keratoprosthesis in your right eye. Can you describe to me the impact it's had on you?
It's totally changed my life. I can get out by myself now, go for a walk, go to the mall, see friends, just do many, many things that I wasn't able to before.
What was it like before the transplant? Were you able to get out on your own?
No. No, I had to have someone with me all the time because I just couldn't see anything.
And now?
I can do whatever I want to except drive.
Do you have any pain in the eye?
No. No.
How long did it take before you got your vision back after the artificial cornea transplant?
By the afternoon, I could see across the street at home and various things around the house. And before many days, I was looking at photographs, and it was just like Christmas.
So it's had a major impact on your life?
Yes.
Thank you very
Fantastic.
much. Thank you. Now again, these are not perfect. We have had setbacks, infection, glaucoma, but thank goodness we're able to reverse these setbacks. And remember, without this, there really isn't another alternative. Our last patient, 75-year-old lady, bilateral stem cell disease, and also blind in both eyes. And this is her story. You had a Boston keratoprosthesis for limbal stem cell disease in your left eye, performed about 8 months ago. And before that, you were legally blind. Can you describe how you're seeing now?
Oh, I'm seeing very well. Much, much better.
Now, is there any pain in the eye?
No pain at all.
How long did it take you before you started to see?
The next very day when I came in, I could see.
And how's it been overall? Has this had a major impact on your life?
Oh, yes. Life is back again. I can see, and my life is much different now.
Thank you very much. Okay, so getting close to the end of my talk, what are our future goals? Our objective is to build on and honor the vision of Owen and Morta Boris. The Donald K. Johnson Eye Center is now positioned to be, in North America, a leader in ocular stem cell transplantation. And this is how we plan to accomplish this. As I mentioned before, I will be visiting centers of excellence in stem cell transplantation in India, Japan, Spain, and Italy to identify best practices. I'd like to collaborate with the Toronto Western Research Institute's Vision Science Research Program and, importantly, the McEwen Center for Regenerative Medicine at UHN to recruit a full-time PhD researcher with an international reputation in stem cell transplantation and artificial corneal transplantation. And thirdly, I want to develop an ocular stem cell facility for expanding these stem cells ex vivo. This is an important new step. This is not being done, to the best of my knowledge, anywhere in North America, where we would be able to take a very small donor specimen of healthy stem cells, grow them in a test tube, and then be able to keep them for the life of the individual. We'd like to be the first center in North America doing this. So in conclusion, stem cell disease is a chronic, blinding, and painful condition that has a devastating effect on a patient's life and significantly on the lives of their loved ones. Currently, there is no other treatment available to address this problem. Rather than send patients outside of the country, we have started a comprehensive transplantation program at University Health Network to treat stem cell disease, focused on 2 operations: ocular stem cell transplantation and artificial cornea transplantation using a Boston K-Pro. This program is now funded by the Ministry of Health and is unique in all of Canada. Our success is directly attributable to the efforts of many dedicated individuals. I want to stress the fact that this really has been a team effort. My future goals are to collaborate with the McEwen Center for Regenerative Medicine and the VSRP to help us bring the miracles that are occurring in the laboratory to the patient's bedside. This ex vivo expansion program will be the first and only one of its kind in North America. Before I take any questions, I'm very pleased and proud to introduce a special and courageous young man who has agreed to share with you his remarkable story of living with stem cell disease and his experiences after his stem cell transplantation. Ladies and gentlemen, please join me in welcoming Mr. Taylor Binns.
Well, just first of all, thank you very much for coming today. Obviously, this means a lot to me, this kind of research. I can tell you right now, there is basically zero research being done out there on things like this. And to be able to help anyone in any way possible will mean the world to me and everyone else who has dealt with this. So I'll go through my story a little bit of the last 5 years, fill in what I can, try to keep it as light as possible. I know it can be a little bit emotional, at least having my family here too, it affects them a little bit. So 5 years ago, yeah, I was in university, went to Haiti, came back and had just severe redness in my eyes. For the next 8 months, it got worse and worse to the point where it was just blinding. And I was told that I had pink eye. I was told 5 different times by 5 different doctors I had pink eye. It then got to the point where I could not go outside for a week because the light sensitivity was so bad, the redness in my eyes, the pain, that it was just affecting everything. So I ended up waiting approximately, I think it was 8-9 hours in an emergency room one night, finally at a hospital that had an ophthalmology unit. I was rushed into an ophthalmology clinic the next morning on a Saturday. A doctor came in at 6 in the morning that day, and since that day I haven't left an ophthalmology clinic, it seems. So as this was occurring, nobody knew what was going on. Nobody at all. I saw, I think we say about 30 different ophthalmologists. My ophthalmologist at that time was going to different conferences, asking any doctor she possibly could, and no one really knew what was going on. And as this was occurring, the pain just got worse and worse. I started losing vision to the point where I couldn't see the lecture screen in class. I was still going to university at this time. And it got so bad, the blindness, and now I find it kind of funny, but I was quite a stubborn young boy. I still feel I am, that I refused to admit that there was anything wrong until one day I walked into the back of a car because I could not see the car. At that point, I kind of took a step back and said, all right, there's something wrong here. Let's get this figured out as quick as we can. And I started looking at other doctors and things like that. So as the pain and everything, I was to the point where I was taking 40, 50 Tylenol a day to deal with the pain. I didn't leave my bedroom at one point for 3 weeks. This was during school. The only time I did leave was for the countless appointments I was going to. I can say somehow, and I don't know how I managed to graduate university on time, just teaching myself how to learn different ways. But worse than losing the vision, the pain, is just not knowing. I spent 3 years not having an answer, and once you get that answer, it's just kind of a relief. Like, I don't care if I go blind, just tell me what's wrong with me and get rid of this awful pain. So like Dr. Slomovic was saying, I went down to Cincinnati. There I was told I had this and the procedure was being done. You talked about numbers, how much it cost. It's great how much it cost the Ministry of Health. Personally, imagine a university student having to go from Kingston, Ontario down to Cincinnati every week for years on end. If there's an appointment, I have to be rushed down there by a flight. We figured it out, it was going to be well over $150,000 personally to have this done down there. So for me to have a program like this and Dr. Slomovic and just the ability of UHN to take the risk and the innovation in something like this, to have that support network close to home, my family, if there is a problem, which did occur once or twice, I could take just a bus or a train and be there in a couple hours, is massive to me and meant so much. So I can say after surgery, and every time I see that video and I see the part where my sister starts speaking, I'm good until that part. Then I get a little teary-eyed. I've got a little emotional, I feel, through this. I'm not a hard rock anymore. But I just want to thank her, first and foremost. She deserves more credit than I ever do. I keep saying she's the girl who couldn't put eye drops in her eye, yet let someone cut part of her eye out. Not just once, knowing the pain that occurred after that one time, but she did it twice. So I wish more than anything she could be here today and be up here beside me. Unfortunately, she's not living anywhere near here anymore, and it just wasn't feasible. Dr. Slomovic, without the ability and the chances that you took and the countless hours I know that you spent on this, and Dr. Slomovic's family, I know they're here somewhere. There they are. The hours that he put in, I'm sure it was rough on you too. I can remember him coming in Monday mornings and him saying the entire weekend was spent on this. So thank you for you guys too for being there for him. My family, who's up front, taking up almost 2 rows, it seems. Thank you very much for everything you guys have done. It's nice to have you guys here today and be able to share this with me. I've been doing a few of these, and to have you guys here means the world to me. Dr. Slomovic's team, everyone who got the afternoon off to come to this, it got to the point where it felt like a second home, and to see those faces every week smiling, it meant a lot to me, and to have you guys here means a lot today too. Dr. Cole's team, and everyone here that came today to learn more about this, the foundation that's being started, I can just say thank you to all of you. So in closing, thank you everyone, and I couldn't be happier right now.
We have time if there are any questions anybody has. I'm more interested in answers that you might have, but I'll take questions too. You want to? I
just wanted to let everyone know that we have 2 staff members with microphones.
Do you want to sit on my lap?
So if you have a question, if you could please raise your hand, and we'll come right over to you with the microphone. Thank you.
Thank you very much. No, I'm not taking.
And Taylor can take questions.
Taylor? I think there was a question over here.
Yes, doctor, thank you. Most interesting. And my question is, you said that for older patients, it will be using the artificial Boston Cape Pro. you said that the condition like glaucoma could be reversed. Could you explain a little bit? Because I thought glaucoma cannot be reversed. Thank you.
There's two answers for dealing with stem cell disease surgically. One is a stem cell transplantation. When you do this, unlike a cornea transplant, this is vascularized tissue, and for this reason, you need to use systemic immunosuppression. Now, the good thing is it's about half the normal dose that you would use for either a liver or a kidney transplant, so it's better tolerated. But still, systemic immunosuppression has side effects. And there are patients, older patients, who do have stem cell disease who cannot be put on immunosuppression for this reason. For this reason, we have another alternative which works very well. It's called an artificial cornea or a Boston keratoprosthesis. This does not treat glaucoma, it causes glaucoma. So glaucoma infection are the two main conditions we need to be concerned about when performing a Boston keratoprosthesis. So we will always make sure, often working with our glaucoma service, that the pressure in the eye is controlled before we would go ahead and offer a patient a Boston keratoprosthesis. Otherwise, it's doomed for failure.
Thank you, doctor.
Could you stand maybe, because it's hard, I want to make sure everybody can hear. I'll repeat the question, or we have a microphone here.
You cut and then peel the cornea back when you were doing this?
Okay, there's two parts, as I meant, for the transplant or the artificial cornea?
Artificial cornea. No, the transplant.
For the transplant, you don't peel the cornea back. Basically, you're simply replacing the damaged cells, the damaged, scarred, vascularized cornea with an artificial cornea, which cannot develop blood vessels and opacity growing into it. It can develop other problems, but you just go right through, and you don't need the immunosuppression. There's a question over here.
Thank you.
Oh, okay. So there's two questions going on, but could we maybe just actually, since the microphone's there, may I take your question in just so, and you'll bring the microphone over after.
Again, thank you. Taylor's sister had 4 surgeries. Is that because 4 weren't necessary or 3 were not successful? And if not successful, was the lack of success in the harvesting or in the transplanting? Thank you.
She actually only had 2. I was extremely successful with both. So she had them removed, harvested twice for each eye. I only have had 2 as well. So I've had no problems whatsoever. There hasn't been any complications, any rejection on my part.
Thank goodness, thank goodness. But I think what the point is with each operation, there were 2 areas that were harvested of stem cells. And so where there was 2 operations on each, on Vicky and on Taylor, there were 4 stem cells removed and transplanted. We'll just take this one and then we'll go there.
My question was actually related to the last posed. I wondered if the sister recovered easily after being the donor, or if there were difficulties on her part.
She was about 3-4 days. She was back to normal. It's a little longer for me. It was personally. I was probably about a month until the pain was going away. But yeah, it's not as severe a recovery for her, and especially now with the things occurring where they could just take a tiny little bit and grow that could help massively, because you can imagine taking something like 30-40% of her stem cells. It is surgery, and being able to do that and not take as many could help even her recovery even more.
Thank you.
That's our goal, as Taylor points out. If we could, this is a remarkable young lady. there was a lot of pain for about 3 days afterwards. And knowing that there was this pain, she still went back and did the other eye. And she actually wrote to me, when is this going to happen? So, you know, when you're going through government and other bureaucracies, things take time. I mean, this took at least 500 hours of work to get both programs up and running. Work behind the scenes. So it took a lot of time, but she was a very brave young lady. But if we could just do, imagine this in your mind, if we could take a tiny little piece of her stem cells once, put it in a test tube, and expand it to as much as we want, wouldn't that be wonderful? That's where we're going to. That's, you know, our journey. That's the next step. And we could be the first center in North America, actually North or South America, doing it. There was...
I have a question for Taylor or anybody like him. For the rest of your life, are you now having to go back and sort of get any kind of other treatment, or you're done and that's it?
So far, so good. It is fairly new, like we say. So 100% we don't know what's going to occur with me. I'm young. I'm one of the younger people to have this done. Mine was caused by contact lens wear. Most people, it's caused by contact lens wear, are significantly older than me. So I was told I was the youngest person in Cincinnati they've ever seen based on contact lenses, the least amount of time wearing contact lenses, and the most rapidly increasing case that way.
And not only that, Taylor's voluntarily agreed not to play any more rugby.
Yes. So,
with a little help from his family and friends, he's voluntarily agreed.
Yes, voluntarily. But other than the occasional blood test going in to make sure the eye is okay, seeing the nephrologist for all the medications and the immunosuppressant drugs, which we don't really know how long they could be. They could be forever. They could not be. That's the only real ways that it affects me now. I have no pain. I'm 20/20, like I said. My life's back.
Yeah, I have a question. You said that the K-Pro, the artificial lens, is used with older people because of the issues. But we have been told that with the immunosuppressants that Taylor has to take, there is a much higher cancer risk. Now,
There is, but...
my question is, why aren't we using the prosthetics more than the stem
Okay.
cells?
So the question, can I rephrase it and make sure I get it right? If I don't, just let me know. Question is, some of the immunosuppression, some of the drugs can have a higher risk of cancer. Why are we not using the Boston K-Pro, which doesn't require immunosuppression for everybody? That's an excellent question. First of all, Taylor's off the medicine. He was on only for a short period of time. As I was saying, unlike other organ transplants that are much more vascularized, I think you're on 5 milligrams of prednisone, which is almost homeopathic. So, and he's been on that for a while. Still monitored, and obviously we'd like to get him off everything. It's risk-benefit, but this does not increase any risk of cancer. We get patients, you know, that's where the renal transplant service really is wonderful to have them with us. They have years of experience. Plus, we use half the dose used in other areas. Now, why not? So that answers the immunosuppression. There's just a paper published by Ed Holland, who I went to visit before coming down, showing the lack of complications in the immunosuppression for stem cell that has not zero, but a lot less than in other solid organ transplants. So the next question, why not do a Boston K-Pro in everyone? They have their problems. They have their problems. We've run into infection, we've run into glaucoma, melting. None of this is perfect. And none of this is the same way we're going to be doing this in 10 years from now. But it's pretty darn good. If there were other options, maybe we would take them. But there aren't. You heard, I mean, you know Taylor's story. A transplant would not have worked. Our patient who had the 4 previous transplants elsewhere, a 5th one was going to fail. We have Mrs. Hogg here who had no vision at all, just light perception. We ran into a serious problem of an infection. We've turned it around and now she can see. But it's not for everybody. If you can avoid that, if you can do a stem cell transplant and then taper patients down to a very low level of immunosuppression, it's a much better way to go. I can't see from the light.
This is a little bit off the subject, but I was wondering how stem cell research is coming along as far as AMD.
That's I keep getting that question. There are two other areas in ophthalmology where stem cell research is taking place. One is glaucoma, and the other one's AMD, for those who don't know, is age-related macular degeneration, also retinitis pigmentosa, championed by, I think his name is Flynn, who owns one of the casinos in Las Vegas. It's a journey. It's a journey. You're not going to get good vision with AMD yet, but there are some significant gains that we are starting to make on that. But it's going to take time, and it's going to take research. Two more questions? Okay.
Dr. Slomovic, thank you for this excellent presentation and for that the wonderful work you and your team are doing in this field. My question is, in the case of a patient who has had multiple corneal transplants that have had different problems and side effects, is it possible to jump either into stem cell implementation or this Boston KPRO in the case where transplants, the corneal transplants, just aren't working?
Yes. Well, if everything else is okay with the eye, usually after there have been several transplants, there may be other problems like glaucoma and other macular degeneration. If the eye is otherwise intact, 100%, that's one of the areas where the Boston K-Pro really shines. It really does very well. Last question.
Doctor, with respect to injury, eye injury, may I ask if you've had any or a number of accidental situations presented to you by members or people who are covered by workman's compensation?
Yes, I have.
I can help you. The Ministry of Health and you are obviously on the same team. 2,000 versus the 53K in Cincinnati.
Easy math.
All of us have observed that the city is under massive reconstruction. On every corner, on every second street, they're digging, they're replacing sidewalks, they're replacing potholes, etc., etc. There are 6 men wearing yellow hats. The one wearing a white is doing the pneumatic drilling or the slicing of asphalt. Now, each and every one of them is wearing a hard hat because something from heaven might fall onto their head. Each and every one of them is wearing a steel-toed boot to protect their toes. But none of them, doctor, is wearing glasses, safety glasses. If you could work your magic on workman's compensation through the Ministry of Health to impress upon workman's compensation headquarters that each and every man, woman, and child working and covered by workman's compensation must wear safety glasses, it would cut down tremendously on the draw of the OHIP bank, and there'd be more money for your research.
I think that was a comment, not a question, so I'll leave it at that. But anytime you want to donate a couple of 100 hours, I think you bring up an excellent point. Absolutely. Prevention is so much better than cure, than treatment. Do you want to say some concluding words? Thanks, Taylor.
Well, I wanted to say thank you to Dr. Allan Slomovic.
Taylor, thank you.
And to Taylor Binns for an absolutely eye-opening and wonderful presentation from the review of the stem cell transplantation program right through to seeing the actual footage of Taylor's surgery. Very, very inspiring and meaningful. such a story of courage, and want to especially thank you for bringing your entire family here today to share this moment with us. I would also like to just take a moment, if I may, to thank a number of the individuals that worked on the event today. So first and foremost, I'd like to thank our President and CEO, Tennis Hansen. I would like to thank Louise Aspen, our Vice President for Advancement. I'd also like to thank Doug Earle, who is our campaign director for the BRAIN campaign. The Vision program is part of the BRAIN campaign, which is in fact a $200 million campaign to build and outfit and staff the new Crumble Research Tower at Toronto Western Hospital. So thank you, Doug, for everything you have contributed to our presentation today. And of course to my extraordinary team for all of their work on today's event, Robert, Brady, Rebecca, Jody, Seema, Emmy, and all of our volunteers that have assisted today. If you would like to know more about the stem cell transplant program or how you can save someone's vision, please don't hesitate to contact me or Robert Windrum, who works on the Vision campaign. And most of all, I would like to extend my heartfelt thanks to all of you for generously supporting our hospitals, for making the incredible life-saving work that takes place here every day of the year possible. So thank you once again for coming today. I'd like to wish all of you a safe and happy holiday and a pleasant afternoon and weekend. Thank you.